In this video, we are going to talk about suturing in periodontal surgery. So let us begin by talking about surgical needle anatomy. Now, a surgical needle has a basic design that is made up of three main parts. Understanding these is crucial because each part plays a specific role during suturing. Wag needle is really interesting because the suture and the needle are joined as a single unit. And this is actually very important because it reduces the tissue trauma. So you're not dragging a separate thread through the tissue, which can minimize the damage. Next, moving along, we have the needle body. This is the widest part of the needle and it is often referred to as grasping area because this is where you hold the needle with your needle holder. Now, the body of the needle comes in various shapes. It can be round, oval, rectangular, trapezoid, or even side flat, depending on the type of the tissue and the procedure. Finally, we get to the needle point. This is the tip that penetrates the tissue and it runs from the tip to the maximum cross-sectional area of the body. Just like the body, needle point comes in different shapes. It can be conventional cutting, reverse cutting, side cutting, taper cut, taper, or blunt. So choosing the right tip is essential for controlling trauma and ensuring precision in suturing. Now, in addition to these three main parts, there are a couple of other important measurements you should know. First is the chord length. This is the straight line distance from the tip of the needle to the switch. And then there is the radius, which is the distance measured from the center of the circle to the body of the needle, assuming the curve of the needle were to continue into a full circle. This helps us understand the degree of curvature, which is important when navigating different surgical sites. Let us take a moment to look at the different types of needle points. So, the first one we have is the conventional cutting needle. This needle has its third cutting edge on the inside curve, and because of that, it tends to cut through the tissue quite aggressively. In delicate periodontal flaps, it can sometimes predispose the tissue to tearing, especially on the exit side. Now, when we move from that to the reverse cutting needle, you will notice third cutting edge shifts to the outside curve. And this single change makes a big difference clinically. Because the cutting edge is external, it reduces the risk of needle pulling or ripping the gingiva as it comes out. So this is the one we most often choose for periodontal procedures because it gives strength without causing unnecessary trauma. Next, we have the taper point needle. Now, sitting between the taper point and the cutting needle is the taper cut needle. So this one starts with a tapered design, allowing a smooth entry, but it transitions into a cutting body, which give you little extra strength to get through slightly denser tissue. And finally, we have the blunt needle, which you can see here. This one does not cut at all. So most of the periodontal surgical needles are either 3/8 curvature or 1/2 curvature.